All right. My name is Hank Guzman. I'm a student physical therapist. And today we have Kevin in the clinic. He's got some osteoarthritis in his right knee. So we're going to use the electrical stimulation machine. We're going to do some high frequency tens on it. We're going to try to stimulate the alpha beta nerve fibers to try to utilize the gating theory to kind of block out the A delta and the C fibers, which are the nociceptive fibers going to the dorsal horn, and kind of block those pain signals being transmitted up to the brain by utilizing some high frequency tens from the electrical stimulation machine. So some contraindications for electrical stimulation would include, like, if you had a pacemaker, we wouldn't be doing this up near his shoulders, up on his upper body, anywhere. If you have a pregnant patient, you wouldn't want to do it anywhere around there. But the most relevant contraindications for this case would be if you had any like sensory deficits or skin lesions around his knee. So we'll just do a quick inspection of the skin around the area that we want to do, and we're just going to...
consent.
True. So is it okay if I feel around your knee area here? We're going to do a quick skin inspection just to check to make sure that you don't have any lesions or pain. And do you feel all this?
Mm-hmm.
Okay. So he's got all of his right sensory stuff there. He doesn't have any lesions, so we're good to go for this treatment. So, Kevin, the point of this treatment is to utilize the gating theory through stimulation of the alpha beta fibers. So essentially, you're going to feel like a tingling sensation at your knee, and it's going to help take your pain down. So your chart says that you're up at a 5 to a 10 for your pain. We're going to hope that this brings your pain levels down. So what would you say your pain level is at right now?
5 out of 10.
5 out of 10? Okay, so hopefully by the end of the treatment, we have you reporting a lower score.
Yeah.
So I'm going to hook up the electrodes here. So I'm going to put one on each side of his knee so that we can get the current to kind of flow through the tissues at the knee here. All right. And then we're going to come over to the machine and get it set up for this. So we're going to put it biphasic. We're going to put our duty cycle to continuous because we want that continuous paresthesia, that tingling, that stimulation of the beta fibers to utilize this gate theory. Time, we're going to put this up to around 30 minutes for this treatment. Our rate can be anywhere between 80 and 110, so I'm going to use 100 for this treatment. All right, and then our pulse width, we want that to be below 200, so I'm going to go to the 100 range to get that paresthesia, that A beta stimulation. So now for the intensity, I'm going to take that up slowly until Kevin reports having like a nice tingling sensation, and it shouldn't be painful, and we don't want to see any muscle contraction. So if you start feeling like your muscles going, just let me know and we'll back it off. Okay. All right. We want to have a nice kind of strong tingle. And okay. It should help. All right, so we'll take you up nice and good pace here. Just let me know when you start to feel a little tingle. Should be close.
Okay, you can feel a tingle.
A little tingle? All right, we'll go a little slower then.
And keep going.
All right. Just remember, if you feel your muscles start to go, that's when you want to stop it.
Right there.
Right there? All right. So then we'll start the program. All right. And that still just feels like a gentle tingle for you?
It's a tingle with no muscle.
Well, like a strong tingle? All right.
Feels good.
Sounds good. It feels good?
Yeah.
All right. So by doing it this way, we're going to get the current going through his tissues around where he's going to experience his osteoarthritis symptoms. And They're gonna stimulate those A beta fibers, prevent those A delta and the C fibers from spreading their nociceptive signals at the dorsal horn further up to the brain centers. So this should help to effectively block his pain during the treatments and after, and make the rest of what we want to do in terms of like his exercises for his appointments today and in the future a little bit more tolerable. So Kevin, how does it feel so far?
Feels really good.
Feels really good. So if you had to say what your pain number is at now, is compared to like when you started, does it come down at all from your 5 out of 10?
Currently, it's maybe like a 3 or a 4.
A 3 or a 4. So it is coming down a little bit.
Just a little. Yeah.
And we would expect that as we went longer.
It does feel better than my 5.
Yeah. So we're trending in the right direction. So we would expect that as the treatment continues and as that gating theory kind of builds up, that you would get lower and lower pain numbers. All right. So we're going to take you off of the treatment here because we finished up the video. And we're going to double check your skin. Make sure that there's no redness or any sort of irritation underneath. And yeah, we're looking good. All right. That wraps up.
And I'll see you in class Monday.